Hello once again, beautiful people. It's your tooth doctor, Maureen Mora here. Welcome back again to my YouTube channel. All we do is talk matters oral health, simply because I do believe everybody is entitled to good oral health status. And in today's video, I want us to talk about some of the systemic risks that are usually associated with poor oral hygiene. So, as much as you may know that maintaining good oral health and having your routine dental checkup done with your dentist, I don't know if you are aware that your oral health status have a significant effect on your general wellness, and that is why we are here today. And with me, I have Dr. Walong, who is going to help me break down some of these issues, ranging from pregnancy loss, respiratory illness, kidney issues, diabetes, and so much more. Stay tuned for us to be able to have an interactive session. Thank you so much, Dr. and welcome to my YouTube channel.
Thank you very much, Doctor, for inviting me. I'm happy to be here. First, I'd like to thank you and commend you for this lovely blog post and what you're doing to the community in terms of providing amazing health education. I'm a pathologist. My name is Dr. Edwin Walong. I teach at the University of Nairobi, and I also practice anatomic pathology. And through my work, I have seen instances in which poor oral hygiene leads to an adverse or a bad health outcome. And there are several examples that I will talk about today.
Yes, you're most welcome, Dr.
Right. So the first example I'll talk about is a story, a recent case that I did examine. One of our obstetricians asked me to perform a fetal autopsy, and this is a case where a baby had died in the womb, really. So it was an intrauterine fetal death, that's what we call it. And the diagnosis of intrauterine fetal death was made on ultrasound. And what was sad is that this was the fourth occurrence of the same kind of, of a similar outcome in a woman who had lost 3 other pregnancies at about the same gestational age, and that was at about 5 to 6 months. And when I investigated that death by performing an autopsy of the fetus and also examining the placenta, the cause of death in that particular instance was an infection in the placenta, which we call chorioamnionitis. And the infection of the placenta made the placenta not work well enough, and therefore the fetus died as a result of failure of oxygen flow. And the cause of that infection, we realized, was a very specific organism, which we classified as group D streptococci, that typically would occur in an individual who has poor oral health. And when I communicated this back to the patient and the gynecologist, there was only one intervention required for this woman, that she had to undergo a dental check prior to her next pregnancy. And now we are hoping for a much better outcome. And this situation is fairly common. In one of the series that I I participated in, we did realize that the infection occurring within the placenta may be resulting from dental infections, appears to be one of the major causes of prematurity. These are babies who are delivered early before they are fully mature, and the reason for that is that infection in the placenta. So for pregnant women, definitely good oral hygiene and proper oral health would prevent such needless pregnancy losses. The magnitude of this could be quite high in our population, and we think that if people are sensitized to this particular condition, then we might have much better outcome in their pregnancies.
Thank you so much. So clearly, it means these systemic conditions have really caught the attention of most of our researchers.
Indeed, indeed. In fact, in one of the series that we are examining the causes of fetal deaths, fetus, of course, is the unborn child. What is causing deaths in an unborn child? And one of the major causes, of course, is this infection in the placenta. The question is, how does it occur? So when there is a poor oral health, then there are areas within the teeth, in between the teeth, or within the mouth where bacteria tends to grow, and the bacteria that's growing at those sites are bad bacteria. And in some situations, this bacteria will find their way into the circulation. And anything that, there are minor things that will cause that to happen. Just the act of chewing or grinding of the teeth, or even anything that manipulating the teeth or brushing the teeth will dislodge those bacteria into the bloodstream. And that is how they would find their way in this site, causing this dental infection. And and addressing this becomes quite an important intervention for healthy pregnancies.
So my beautiful people, as you get it from our specialized doctor here, Dr. Walong, clearly maintaining oral health hygiene is good for your health and for your smile. However, what is bringing in board significantly is that poor oral health can as well affect your other systemic issue. Sorry for the mother who lost the baby, and this is why we are doing this. Hope you're going to learn something, help a friend.
Absolutely. And there are many other examples in which the poor oral health would cause significant disease in an individual. Let us look at the heart. The heart is a complex structure. Inside it, its job is to pump blood all over the body, and it has various parts. There's a surface, the inner surface, which has valves that regulate the flow of blood in one direction. These valves are susceptible to infections that also find their way in a similar, just as I've described before, when there is an infection within the tooth or within the mouth, and it finds its way into the bloodstream. Some of them can actually form seed within the heart valves and form what we call a vegetation. So a vegetation is like a focus of infection that grows on that valve, and whenever it's there, it means that this valve will have compromised function, because the body will try to get rid of the infection of the valve, but in so doing, it might cause what we call fibrosis, or changes that eventually injure that heart valve. And individuals who have that, one of the main interventions, of course, for them to prevent it and also to take care of them will be to deal with that oral infection. Additional examples, of course, are certain cancers of the airway tract and the esophagus. There is a strong link to cancer of the esophagus, and there's a tendency that it tends to occur in individuals who have a long-standing history of poor oral health. They have lost teeth. They have areas where you can see that their teeth are definitely not healthy. And the bacteria that sit there will cause inflammation along the airway, and through mechanisms that are still not well understood, may eventually end up to the situation of cancer of the esophagus, cancer of the throat, and various other cancers involving the airway and the aerodigestive tract. Therefore, if we look at the diseases that occur just because of poor oral hygiene, then the list is quite endless. Systemically, there are certain situations where the body is responding to abnormal bacteria, what we call the microbiome. So the microbiome is the sum total of all the bacteria in the body. And remember, one thing is that there are lots of good bacteria and bad bacteria, and the balance between these bacteria is very important to the health of an individual. The oral microbiome forms a significant part of this chunk of bacteria, and just having healthy oral bacteria has been shown to even prevent additional diseases such as blood vessel diseases that cause heart attacks and so on. If this bacteria is not the healthy kind, then people are at an increased risk of additional blood vessel disease. some of them are usually quite debilitating. So having that healthy oral microbiome becomes a very important health status that I think there'll be a lot of significance as we go on and as our health systems become a lot more sophisticated.
That's amazing, Doc. So in our dental setup, we have also other systemic diseases like diabetes, patients with diabetes. So a client walks in, you do your history well, and then when you ask about their medical conditions, the patient is like, I am diabetic, and to us it's a matter of concern because there are some procedures, ideally when we do, we are sensitive about them. For instance, tooth extraction to a diabetic patient might prolong the healing time, hence the wound becomes infected once more. Apart from that, are there any researches or anything that would come up on the same about diabetic patients?
Right, and diabetes, of course, we know that there are two main types. There's a type 1 that tends to affect younger people, and there's a type 2 that tends to affect older people. And the type 2 is more common, and it's related to various environmental exposures. So we are looking at diet, sugar-based diets, and lack of exercise, sedentary lifestyles, and so on, that eventually cause type 2 diabetes. So the reason type 2 diabetes occurs is because there has to be some injury to the to the pancreas, but most of it is the body is unable to deal with the excess sugar, and that brings about a broad inflammatory state. And the contribution of oral microbiome to that is a matter of study. So the diabetics, of course, are susceptible to additional disease due to the impaired healing and repair because of the injuries to the vessels that occurs in diabetes mellitus. So because of that, certain injuries in the blood vessel, then there isn't usually good perfusion, and therefore the healing related to that is usually not that good. So these individuals may require a more strict regimen towards their oral health because, as you've mentioned, and the good thing is that you're the expert here, you can provide care in a way that will maintain their dentition so that they don't lose their teeth in the first place. And when they lose their teeth, then you can see that they have additional complications as a result. So I think that's one challenging area. But the good thing, you're the expert there, and I know you have been providing very good care to these individuals.
Thank you so much. We try to do our best to the level we know how to do best. So clearly, my viewers, what we are getting here today is that our mouth is a very crucial part in our body, and it communicates a lot to our general well-being, clearly.
Definitely, and I think from my experience, if you take care of the mouth very well, then you will reduce overall health costs in the future. And the tragedy of our practice is that most medical insurances tend to give very little prominence to oral health, including our national health insurance fund. So we think that a wholesome individual will need good oral health because of the various examples I have provided, be it the health of the mother and unborn child, the health of individuals to prevent various chronic diseases such as diabetes, hypertension, heart diseases, and cancers all rely on very healthy or very good oral health care. And we can do that without the dental specialists.
So I think just to add on that, there is also another effects systemically that might come up with poor oral hygiene, and that is nutritional deficiencies. Yeah, so for instance, if assuming that you have not taken good of your oral health, the probability of you losing your teeth is quite high. So clearly, if you don't have teeth, there are some limitations of food that you are going to be limited taking because your mouth does a lot of that grinding.
All right, right, absolutely. And you've reminded me of another group of diseases that I haven't talked about, and those are diseases that affect the liver. And there are lots of diseases that affect the liver. I'll just focus on one called alcoholic or non-alcoholic fatty liver disease. So people who take alcohol sometimes develop fatty liver, meaning that there is injury to the liver to the point that the liver cells are substituted by cells that have accumulated a lot of fat because of the failure of the liver to break down fat. And with accumulation of the fatty liver disease, many times if the individual say, stops drinking alcohol, then the fatty liver disease tends to clear on its own. The individuals who develop fatty liver disease, not related to alcohol use. But now the good thing is that the liver has a strong capacity to regenerate. Once the injurious agent is dealt with, it tends to reconstitute to its former state. However, there are situations or certain circumstances where the liver might get an additional injury, where in addition to the fatty liver, there is inflammation. So inflammation is a reaction of the liver where there are cells from the immune system that come in, and this eventually cause additional damage. So we call this a steatohepatitis. And the main reason these individuals develop steatohepatitis is because of actually harmful bacteria that are swallowed into the stomach and find their way into the small intestine and are absorbed and find their way into the liver through the bloodstream. And these bacteria, many of them may be residing in the oral cavity. So to prevent significant liver disease related to this so-called fatty liver disease, then we have to minimize the bad bacteria in the oral cavity. And that is why we will need oral health to even prevent diseases of the liver. And it seems that there are lots of examples or lots of disease processes that will be prevented just by proper oral hygiene and care.
Amazing, amazing. So my good people, anytime I'm here talking to you about maintaining good oral hygiene, brush your teeth well, do your routine visits to your dentist, we are not just focusing on the mouth, we are just focusing on your general well-being.
Indeed, indeed. And of course the definition of health means that there should be wholesome physical, of course, emotional, spiritual, and so on in terms of well-being. And you cannot neglect one part of the body, there will be ramifications everywhere. And the oral cavity appears to play a much stronger role on that.
Amazing. So thank you so much, Doc, for coming to my YouTube channel. That was an amazing session. I have learned a lot, and I hope so is to you, my viewers. Every day is a learning day. Kindly, if you find this information helpful to you, feel free to share. It might help someone somewhere. Till next time, let us meet in our next session.